Okay. So I actually, Mercy did most of the presentation correct. I was in residency, but I resigned to come over to the States because my family lives here in the U.S. now. And I was doing also general practice while I was in Mexico. So I'm going to be brief too. It's been a long day for all of you. And we're presenting just some advances of what we've been doing over the past few weeks. And as Mercy said, I think there is a lot of research, a lot of still things to do about lifestyle, not only the food or nutrition, but in general lifestyle. And so we're presenting this. The title we call, as you see, is a whole food plant-based diet protocol, that was developed by Mercy and Joyce. And you probably, majority of all of you might have the book, either physical or the PDF format. And just I want to be brief on the background about the autoimmune diseases, because we're going to talk about specific autoimmune disorder briefly. Oh, okay. All right. Okay, thanks. So we're going to talk about autoimmune diseases briefly as a presentation. So autoimmune problem, as you're seeing, is there are two things. Autoimmunity, which can be considered as the present, is a reaction to itself. That is, most of us, we react. We have an autoimmune system, right, that usually reacts to ourselves, but then it calms down. It's normal. It's part of us. We all have that. But when that is combined with some sort of clinical manifestation, any symptoms, that is called an autoimmune disorder or autoimmune disease, right? It's a dysregulation of the immune system. The exact phenomena or what actually occurs is unclear until now. There are risk factors, environmental factors, things around us, the food we eat, how we behave, stress. Genetics plays a huge role. And as you see there is no cure, and most of the times, someone has to be with a long treatment for entire life. So there is an increase. This is a figure that talks about, and I'm going to focus now a little more on inflammatory bowel disease. As you see here, there is some this is the inflammatory bowel disease. As you see, it's been increasing worldwide. There is increased prevalence, which means there is more autoimmune disease related to inflammatory bowel disease. And this has been just recently reported. And this is just recently from 2000 until around 2017, all the way up 200 cases to close to 450 per 100,000 people. That's more like double just during this century. And prior to that, before, like in the 1970s, as you see, just for Crohn's disease, used to be about 170 for 100,000 people, now to close to 250, just for Crohn's disease. And that was until about 2010. And that's about 50% increased, that's what we're going to be talking today a little more, Crohn's disease. And there is also a paper from the UK that was published last year, and they presented that the most common autoimmune diseases that they identified between 2000 and 2019. It's a database that they pulled from all the registers they have in the UK. And then we have here, inflammatory bowel disease. And all these diseases. You probably heard of some of them. And now incidence. So what happens, they did a study and tried to identify how many people are getting this disease every year throughout these about 20 years. And as you can see, inflammatory bowel disease is been increasing here. There are other diseases, as you can see, are increasing as celiac disease, Addison disease. They're almost like 1.5 or almost twice other autoimmune disorders or diseases. And interestingly, this also shows that some other diseases like Hashimoto's is a problem that affects the thyroid, and anemia pernicious anemia has decreased. But the majority have increased, or some of them have remained the same. Now, I just wanted to bring to your attention, these autoimmune disorders are not very common, so you need larger numbers in order to identify any difference. So that will explain some of these no major changes on these ones in the middle. So I'm just bringing that as to set up, and we're going to talk a little bit more about the Crohn's disease, and then we're going to jump into our case. So Crohn's disease is an autoimmune disorder, right? It's an inflammation of the GI tract, and it increases, it's been reported to increase strictures or fistula formations. Stricture means pretty much stenosis, right? So the GI tract is like a tube where the food goes through, but even if it starts decreasing, it's decreasing the size, that is called stenosis or either stricture, right? So if it goes this way, the food won't go through, and they will cause obstruction and fermentation and translocation of bacteria and things like that. There is no etiology as of now, a clear etiology. There's genetic association, and it's also reported being common in this part of the world, Northern Europe, New Zealand, and also in Ashkenazi Jewish. And interestingly, it's more common in urban settings than rural settings. So people that live probably around this area are less propensity to get this type of pathology or disease. And again, multifactorial. Genetics, environment, and food, right? Things that we put into in our mouth. There are multiple treatments now, and I'm not going into that. Even monoclonal antibodies, which are immunomodulators, pretty much try to regulate the response of our defense or immune system. And so we met, and we decided to start a project, right? And we say, okay, what we can study, and we have what Mercy and Joyce developed in the book that you all know, and also went back and see what's the American College of Lifestyle Medicine is doing currently. What are the principles they base things on? And I've just put this in parallel because you see on the left side, we have they do one of the principles, whole food plant, predominantly pattern. Next is physical activity, sleep, stress management, and there are 6. And if you see what the organization, and I'm just bringing this to this, we know, and some of you might know, all these things that 8 natural remedies or principles as well that is used in the Adventist organization. Nutrition, exercise, rest. As you see, it's similar, most of this. And on top of that, there is sunlight, water, and sunshine. So it's more robust, this side of the table, than probably this. But this is all good already, but it's already included on what is being practiced or being taught in the Bible and the natural remedies. So we got together, right, and we met, and we selected a patient. This is a case report. We're presenting a preliminary information, and we wanted to start a test of the protocol, the autoimmune protocol that you all know, and did a follow-up of 1 to 2 years and see what is the result at the end. At this point, we're at 3 months. We divide it every 2 weeks. We're doing follow-ups every 2 weeks. Then we plan to do every month up to 6 months, and then every 6 months up to 2 years. And our endpoints or outcome measures or the things that we're actually looking is what's the quality of life of the person. It's just one case, so there is not much statistics we're doing on this. What is the Crohn's Disease Activity Index, which is the CDIA score. And we also look at some labs and imaging studies. But I'm going to be focusing a little more on the quality of life and the CDIA score. And now we're presenting an initial review of what we have so far. So this is a patient that has a 56-year-old female. Regarding past medical history, she didn't have any significant past medical history before she got the disease last year in 2023. And at that time, she started developing most of the diseases that you see, kidney stones, the same Crohn's disease. SBO is a small bowel obstruction. She got partial and also reported small bowel obstruction complete and anemia. There are no reports of surgical history. And also prior to that, that's no medications. Maybe, Tylenol or things like that people usually use over the counter. Currently, she's taking this monoclonal antibody that I mentioned, a immunomodulator. It's called actually Iscarizi, but this is the product actual. The other one is the brand name. She never smoked or used alcohol. And this immunomodulator she started using in March, and it's been using this every 8 weeks, one doses. So March, May, then July, September. And she's been following up with the gastroenterologist. And this, as we said, is an immunomodulator, so it tries to regulate the immune system, blocks, interacts, allows reaction or no reaction. Pretty much prevents reaction. Regarding the timeline of what happened to her, she got abdominal pain, distension, diarrhea, obstruction that we mentioned, and had multiple hospitalizations for small bowel obstruction or partial small bowel obstruction prior to June this year, about 3 months ago. So we started a protocol on June 17th. And we're going to go over the graphs, and she noticed some improvement at that time after 2 to 4 weeks of getting into the protocol. Now, but she was not consistent between weeks 6 and 10. So we went over and looked at and measured the CDIA score, the Crohn's Disease Activity Score, and just to talk about a little bit, if it's more than 450, means there is severe activity, and less than 150, it's going into remission. So as you can see, which means the higher the number, the worse, let's put it that way. The lower the number, the best, right? So we started here, we did our interview, then went around 2 weeks, still around there, but then started to decrease in the CDIA score, which means there was an improvement. And getting better, she was under the line of remission. And all of a sudden, that was a huge switch from here to here, and then went up. And we thought this might be related to, it's just one patient, but she also was not complying at that time with the immune protocol. And then she went back to the protocol, but it's been like this, improve a little bit, but then it's kind of like a little rebound here. And at 3 months, this is what we have related to the CDIA score. This table shows us what happened, like everything was going negative, going down, but all of a sudden there was a huge change, as you can see. It's pretty much like 150 degrees change from one side to the other side. That shows us what we have here, from here up to here. And then kind of like, again, it was a little more consistent decrease. It's around here, and it's been the response, or what she's, the CDA score has been around the same. We also measure the quality of life, and we use this form that measures physical functioning, role functioning, social, mental health, pain, and health perception. And in summary, if everything is higher, which means it's good, but if something is going low, means it's not very, regarding pain, so for pain needs to be low in order to be good. But for everything else, everything has to be high in order to be good. So if everything else is low, means it's worse, but pain is the opposite. So if pain is up here, which is the green line, so she got a lot of pain when she started, abdominal pain, right? But then it started to decrease, and we're going to go over to next. So this is pain, for example, right? Started here, just right before, because she was just hospitalized at that time. That was June, before she started with the protocol, she was in the hospital. And then as you can see, it started to decrease, the pain started to decrease. 4 weeks, it's been getting better. So as you see, it's from 100% to 40%, or 40% decrease. It's been the score, we put it at 40% because we're measuring up to 100 points. And then even improved by week 7, but then again, back on, the pain went up again, and it's been remaining as is. Interestingly, most of this, in her case, she was very functional even with the pain, as you see, very functional. And mental health is the other thing we look at it, and we see her mental health's been around similar. Looks like it's a little bit improvement, but it's not very significant change for the patient we have. And we found also some correlations that if when the CDI score is low, she's more functional, right? It's the opposite. And when the CDI score is parallel, it's higher, the pain is higher, no? Which means if the CDI score is low, the pain will be low. And that's pretty much it. Don't want to go into a lot of details, could be a little confusing. That's for her specifically, right? And we don't know, it's one patient. We can, we're going to be observing and see how she does. Of course, there is other things, like she's taking also immunomodulators, this other medication. But so far we see that there might be a good response, and we feel that the protocol that she's been using has been of benefit to her. Also, I'm not presenting the images. We noticed that there was less inflammation on the reports at 3 months and at 2 to 4 weeks after she started with the protocol. And labs there was not many changes in the labs, so, but the images and what we have here, we feel that she's probably going to the right direction. She continues. If she is, keep, doing the protocol as she's been told. Anyway, so that's pretty much what we have. And yeah, that's it. Yeah. Thanks.